Come in. Have a seat. How you doing today? Good? That's great. Can I get a first name and a last? Let's see if we can find you here. There you are. Looks like you're in for your cranial nerve examination, is that correct? Great. Excuse me. So, have you had a cranial nerve examination before? You have? Okay. Well, did you need any refreshers on what we're going to be doing today? Yeah? Okay. What we'll be doing is just a very extensive test of your 5 senses. Sight, smell, touch, taste, hearing. And we'll be going in depth on a couple of them. Some of them don't require much testing, like smell and taste. They don't require that much. So, we're going to get started with a couple of details. I'd like to just get started with, you've already got your name, so how about your date of birth? Okay. Thank you. And how about your home address? Okay. Thank you. What's the zip code on that? Thank you. And what, an email address? Yeah, we'll send you the results via email and phone call if you opt for it. Yeah, no spam. No, absolutely not. And that's a Gmail? Okay, that's good. Yeah, most people use Gmail now. I very rarely see a Yahoo email or anything like that. So can I get a phone number? Very good. Very good. Yeah, okay. And did you want us to give you a call about anything, about any of your results or anything? Just email? Just email, okay. Yeah, most people opt for that anyways. Yeah, I know I'm guilty of not answering the phone if I don't recognize the number. No, now we got caller ID and everything like that, but okay. That's good. I'm gonna go over excuse me. I'll go over your personal history. Can I just get let's see, what's the first question? Sorry, on the wrong page. There it is. Alright, do you have any history of first I'll ask you, do you have any allergies to these things here? Okay. Right. And how about any history of heart problems? That's high cholesterol, high blood pressure, anything like that? Okay. Family history of any of those things? Okay. That's good. How about family history of, or history yourself, or family history of a stroke? No. Okay. Cancer? How about mental disorders, depression, anxiety, things like that? Okay. Ready? That's good. If you could just sign here. Right at the X there. Thank you. Yeah, it's just the consent for me to be able to treat you, and I give you these tests. So we're all done with that. Now I'd like to read on your heart rate. Excuse me. Excuse the collar, Jesus. Okay. So I need you to stay nice and relaxed. Just gonna get right in there. It is okay if I come closer, correct? Breathe normally for me right now. It's good. Good, okay. Go ahead and breathe in for me. Have a nice deep breath. Hold it. Hold it. Breathe out. Good. Nice deep breath in for me. And out. Good. on there. We want to get your pulse, so just put your wrist just like that for me. Good. Very good. Alrighty. Now, we're going to get a little more in depth. I'm going to put some gloves on if you don't mind. You'll have to excuse me if this takes a few tries. These gloves never really seem to fit. I feel like I've been making that excuse for years at this point, but what are you going to do, right? They always seem to tear whenever I'm pulling them on. Sometimes I can get a first try. Like that one there. It's pretty impressive. No, nothing today will hurt or anything. If anything, a lot of my patients here find this pretty relaxing. So, if anything, it should be relaxing. That's something called ASMR. Don't know what it's about, but yeah. A lot of the patients who come here have that. I don't really understand it myself, but what are you gonna do, right? Great. So, I'm going to test your sense of smell first. Actually, before we do that, we'll kind of just go head to toe at this point. So I'm going to get a nice scalp check on you. Forgot to ask, is it alright if I touch you? I know, a little too late, but okay. Sorry. Sometimes I get a little ahead of myself. Yeah. I'm just kind of checking for any lumps, bumps, lesions, cuts, that sort of thing. But it's all looking pretty alright. If you had any lice or anything like that recently? No? Okay, that's good. Okay. Back of your neck there. What's going on with my collar? Sorry about that. Okay. No, that all looks fine. Now we'll move on to your sense of smell. And what I have here is just a little cotton swab and a little scented spray, a little perfume. What I'm gonna do is I'm gonna spray this spray onto the Q-tip, and I'm gonna hold it under your nose for you to smell. And I just want you to let me know what it smells like, okay? When you smell it and what it smells like, okay? Okay, here we go. Okay, you smell it. What does it smell like? Great. Different one here. Okay, you smell it. What does it smell like? Good. We'll get one more. Good. And what does that smell like? Very nice. Yeah, everyone gets coffee. Alright, so same thing. We're going to take a Q-tip. Different one. And we're going to do the same thing with your sense of taste. So, it's not perfume this time, it's actually flavored water. And I'm going to go ahead, maybe I should switch bottles. There we go. And I'm going to go and spray it on, and then you're going to stick out your tongue, and you're going to let me know what it tastes like, alright? Okay. Stick out your tongue. What does that taste like? Good. Switch. What does that taste like? Good. I apologize if you can hear any distracting sounds outside. We are located next to a busy highway, but like I said, we try to keep things as relaxing as possible here. That's what the patients want, I guess. What does that taste like? Good. Alright, that's awesome. Okay. It's very nice. Before we get too ahead of ourselves, I just want to get some measurements. We had a couple of your measurements on file, but some of them don't seem to be there for whatever reason. So I'm just going to get some measurements if you don't mind. So we'll just stay nice and relaxed. should mean that this is completely symmetric. Yes, okay. Sorry about that. Just don't want to get too deep into the test and forget about that. We're going to move on to your eyes now. So we're going to test your vision first, and I've got this projector here that may or may not turn on. Let's get the remote here going. There we go. Alright, so you see the chart okay? Why don't you go ahead and, first, what are those two colored bars on there? Green and red, okay. Now what I want you to do is I want you to read the lowest line that you can for me. Good. Can you read the one below that? A couple of letters. Okay, go ahead. Okay, that's good. And how about the line below that? No, not at all. Okay. No, we only ask that to read the lowest line, and then we ask if you see the one under. Because some people aren't really confident in their abilities to be able to read lower. So when I say read the lowest line you can, I mean it. So anyways, no, that's good. And you get the two colors right. That's 20/20, so that's spot on what we're looking for. Okay, that's good. Let's see if we can get that projector off. It always turns off faster than it does turn on. There we go. Don't really get that. We need to replace that equipment. Okay. Now what I'd like to do, I've got the soft light here, and I just want you to stare at the wall behind me, and I'm gonna check your pupils. That's all right. You're not sensitive to the light or anything like that. Okay. No, only for a second. Wall behind me. Okay. That's good. Okay. Okay. That's great. Now I'd like to take a look at the muscles and your sclera, or the muscles around your eye, as well as your sclera. For that, I've got a bit of a broader flashlight. This one might be a little bit more powerful, but it is required, unless you can't handle it. So, is that too bright? No? Okay. Alright, great. So just, again, stare at the wall behind me. Okay, now look up for me. Good, and look down. To your left. And to your right. That's good. The scleras all look healthy, and as well as the muscles on your eyelids and everything like that. One last light test, unfortunately, I apologize. But I'm going to have a look at the back of your eyes. Now, again, wall behind me, you're used to this by now. I'm just going to get in here with this magnifying glass with the flashlight attached. Get it nice and close. Alright, now the wall behind me. That's good. Alright, look up. Look down. Look left. And look right. That's good. Okay. You alright? Okay. Other eye now. Just keep staring at the wall behind me. That's good. Alright, now look up. Look down. Look left. And look right. It's great. Awesome. Fantastic. Now, we're not quite done with your eyes. We're going to test your peripheral vision and things like that, as well as your tracking. So what I want you to do is, I've got this stick here. I want you to look right at the point of this stick. What I want you to do, I want you to follow just your eyes. Don't move your head, okay? Alright, follow wherever it goes. Okay? That's good. Any double vision at all? No? Okay. Let me know if you see any double vision. That's good. Good. Excuse the nose. That's good. Okay, now I'd like you to look right here at my nose. And I want you to let me know when you can see a finger. come into your field of vision, okay? Good. Good. Good, good. Good, good. Should I cover that eye for me? Perfect. Good. Good. Great. Awesome. Fantastic. Spot on. That eye for me. Thank you. Good. 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 It's perfect. Awesome. All right. So, once again, look at my nose, and let me know how many fingers I'm holding up. Okay. 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 Awesome. All right, fantastic. I think that's gonna do it for your eyes. Let's see here. Just having a look at what we need to do for you today. No, that seems pretty good. Just let's see. One more quick test with your eyes. Right here on my nose. Good. And I just want you to look at the wall behind me now. Now look at my nose. Now look at my finger. My nose, wall behind me, nose, finger. Good. Okay. Now I want you to look at my finger all the way back here and follow it in. Good. Yeah, I made you go cross-eyed there. That's all right. All right. So. No, that's it for your eyes. We are going to move on to your hearing. So, where did I put that? I think it's in here, isn't it? In my pocket. I don't know why I put it in my pocket, but I did. There it is. Got these tweezers here. They make a soft, low noise there. And what I want you to do is I just want you to close your eyes and let me know what side you hear it on, okay? That last one was sort of in the middle. Okay, that's how it should be. Now, you can leave your eyes open now, and I just want you to let me know when you can't hear it anymore, okay? So, we'll start this side. Good. Okay. This side. Good. So for the tweezers, I want to have a look inside your ears. So I've got the same tool I used to look at the back of your eyes. I'm just got this little attachment on it now, and I just want you to tilt your ear to kind of the side there. That's good. That's good. Okay. All right. That's good. Okay. Now, other side. Yep. That's good. Okay. Now they're pretty clean. Pretty clean. That's good. Okay. No, that's good. I'm going to whisper some numbers in your ear, and I just want you to let me know what numbers I say, okay? Alright, so I'm going to kind of make a noise next to your other and whisper some numbers in the other. Pretty self-explanatory, yeah, okay. 4, 6, 10. Good. 17, 21, 9. Just one more time this here. 14, 26, 1. Good. And one more time this here. 99, 100, 2. Spot on. All right. That's actually it for your ears. Yeah, that was a pretty quick test. Now you aced that one. Even with me distracting you, that was pretty spot on. All right, cool. I'm gonna move on to your facial sensation now. So, we have a dry Q-tip this time, and what I want to do is I want to touch certain parts of your face. And what I want you to do is I want you to close your eyes, and I want you to let me know what part of your face I'm touching. Okay? Good. Great. Good. Fantastic. We're going to bring the stick back, and as you can see, there was that point on that stick, and there's a bit of a dull spot. Dull end, apologies. And what I want you to do is I'm going to tap parts of your face. I'm going to have you close your eyes again. Just want you to let me know if it's sharp or dull, okay? Great. So I'm going to close your eyes. Good. Now keep them closed. Okay. Good. 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 Great. Good. Good. Great. That's awesome. All right. That's fantastic. All righty. Now I've got this brush here. Very soft. And I just want you to let me know if let's see here, if you feel the point on the stick or the brush. Okay. So just close your eyes. Good. 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 Great. That's fantastic. All right. So let's see here. We did your sight, smell, taste, touch, hearing. It's your 5 senses, but also with this exam, we also test the motor functions and your muscles and everything. So what I want you to do is I want you to tilt your head all the way up for me. All the way back. Any problems doing that? No? Okay. And now down. Chin to your chest. Any problems with that? No? Okay. All the way to that side. Good. And all the way to that side. Any problems with that at all? No? Okay. And I want you to all the way to that side again. And I want you to just, I'm going to put my hand on the side of your head. And I just want you to push against my hand. That side, push against my hand. Good. Okay. Now, just want you to clench your jaw for me. Just gonna feel the muscles in your face there. Okay, now give it a little jump. There we go. Okay, that's good. I want you to smile for me. Yep. Don't show your teeth yet. Yep. Just like that. Soft smile. That's good. Okay, now, nice big grin. Show your teeth. Yeah, that's good. Beautiful smile. Can you frown for me? Yep. Just kind of really frown so like it kind of moves the muscles in your neck there. Okay, that's good. Now, stick your tongue out. Okay, now move from side to side. Okay, that's good. You can put your tongue back in. All right, that's good. Your eyes nice and wide, just like that. And don't let me close them. Close your eyes just really tight, like you got soap in them. All right, that's good. Great. Okay, Dad, don't let me open them. There we go. All right, so I'm gonna move down to your shoulders. Just shrug your shoulders up just like that for me. Don't let me push them down. Okay. Put your arms out just like that for me, like you got a board. Okay, that's good. Perfect. All right, that's awesome. Yeah, I'm having a look at your skin, the complexion in your face. Everything looks symmetrical. I did take those measurements, and yeah, everything's symmetrical. I'm gonna move on to your hands. Stick your hands just like that for me. So I have a look there. Okay. Look at the other hand. You're just seeing the color returns of the nails. That's good. Now we're going to do some bit of a hand examination. I just want you to clench your fist really like you're going to punch me. Okay, don't let me open it. That's good. And don't let me open it. Okay. Fan your fingers up. Don't let me close them. Don't let me close them. And don't let me close them. And don't let me close them. 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 And don't let me close them. That's good. And we should make a ring like that. Like, don't let me break the circle. Don't let me break the circle. Don't let me break the circle. One more. Don't let me break the circle. Other hand. Don't let me break the circle. Don't let me break the circle. Don't let me break the circle. And don't let me break the circle. Good. Okay. Make your fingers really stiff. Don't let me bend them, and don't let me bend them. That's good. Actually, I think that's it. Just check over here before I take my gloves off. We got that. Got that. That's good. You're all done. Yeah. No. I didn't and see any problems, I will send your results over to your GP, and he'll get you sorted out with results and everything like that. But it's all pretty straightforward. If you just want to sign there for me, thank you. Yeah, no, I didn't notice any problems. Of course, when I get the results to your GP, he might think differently, but I doubt it. I mean, you're pretty spot on with every test. So yeah, if you have any other questions or concerns, you can talk to your GP, or you can call here. The receptionist knows what she's talking about, but if you absolutely must talk to me, just ask to speak to Dr. Ash. Yeah, it was nice to meet you, and you have a good one.